Medical Association journal was later to report that Canada faced the second most stringent restrictions from the G10 countries, and that included the U.S., the U.K., France, Italy, and Germany. By February of 2022, 4 out of 5 Canadians had received at least one vaccine dose. We had the highest immunization rate in the world, and we went on to have the second lowest number of deaths per capita among the G10 countries. So another feel-good is at the time, the provinces and territories were quick to share their health data with Canada's Public Health Agency on cases, hospitalizations, and deaths.
That's the good picture, right? So what's the bad one now?
All right, well, you'll remember ignoring pandemic preparedness. They just dropped the ball. 1 year before COVID-19 hit, the government of Canada actually threw out millions of expired masks, gloves, and protective gowns. And that left healthcare workers getting sick in droves. That meant far more infected patients. Other bads: the anxiety, the fear, the uncertainty, the lost educational and social opportunities, the spike in loneliness and in substance use. Remember those photos of seniors looking out of chronic care facilities?
Oh, devastating.
I mean, there was isolation. They were dying without their family being there, And we learned computers cannot replace classrooms. Female youth became more likely to resort to self-harm. That's according to Government of Canada data. And of course, the deaths. So many of them that hospitals in New York ran out of space. Corpses piled up trying to keep up with the numbers. Over 7 million people have died globally since. That's according to the World Health Organization. And the U.S. saw 20 times more deaths than Canada, even though they're only 10 times our size. A whopping 1.4 million people in the U.S. have died. 60,000 died in Canada, most of whom were over 70. The actual numbers are far higher because of long COVID's impact on heart attack and stroke risk. That now affects 3.5 million Canadians. That's according to Canada's Health Info Base.
Dr. Gorfinkel, what else would you note about the pandemic as, concerns or negative outcomes?
Canada was a vaccine hoarding country. It's shameful to say, but, vaccines were limited. And what that did was it meant that mid to low income countries had more cases, which gave the virus opportunities to mutate more and create more variants that came back to bite later. Canada also dismantled key resources, even though the pandemic was still in full swing. Take a look at Canada's long-term care COVID tracker. Here was the resource that revealed to us that chronic care residents made up a disproportionate number of the deaths. But they closed because the provinces and territories suddenly refused to share their data with the Public Health Agency of Canada. The pandemic was still ongoing. Next came Ontario's Science Advisory Table. That was one of Canada's most trusted go-tos for up-to-date information. Then came the wastewater surveillance program, CHOP, the largest of its kind in Canada. And it got a lot worse because science is now being muzzled in the U.S. by massive funding cuts to the very organizations dedicated to keeping people healthy. The National Institutes of Health, the Centers for Disease Control, the National Science Foundation, Columbia University and Johns Hopkins. These are top-notch schools that deliver advances to the world in cancer therapies and heart and stroke treatments, as well as addictions and mental health. These are threatened by the cuts that will decimate their research.
As a clinical researcher and frontline doctor, where do you see things going?
The misery and the grief of the early pandemic has now morphed into anger, into pushback and misinformation. Pandemic fatigue has created a vulnerability. We've gone from we're all in this together to embracing tribal groupthink, to a willingness to allow politicians to gag science through intimidation, threats, and funding cuts in the U.S. Future pandemics already have the upper hand, thanks to global warming, thanks to industrial farming, thanks to millions of people being packed into cities and the international travel they'll do to carry diseases from one place to another. So what's now lacking is Canada's willingness to take a hard look at our failures over the past 5 years. That is the future guide to managing the next pandemic. And if those hard-won lessons are to be shelved, if they're to be ignored, we can be sure the same mistakes will be repeated.
Dr. Gorfinkel, thank you so much for coming by Breakaway this afternoon.
Many thanks for having me.
That's Dr. Iris Gorfinkel. She's a regular health contributor. She's a family doctor and a clinical researcher.